एसिड रिफ्लक्स कई तरह का हो सकता है। कभी कभी पेशेंट्स को खाली हार्ट बर्न के सिम्टम्स आते हैं कि खाली चेस्ट में जलन हो रही है, लेकिन कई बार इतना सिवियर एसिड रिफ्लक्स भी हो सकता है कि सिर्फ झुकने पे या रात को लेटने पे गले तक या मुंह में या नाक में से भी एसिड का रिफ्लक्स हो सकता है। सो सम पेशेंट्स कैन एक्चुअली कम विद सोर थ्रोट, समथिंग लाइक breathlessness. But if a person is not able to get relief even after being on medications, then in these cases we need to evaluate further by doing an endoscopy, by doing a pH manometry, and then basis those results we can take a decision about whether a surgery for hiatus hernia is required or not. Hello, I'm Dr. Aparna Govil Bhasker. In this video, we are going to talk about hiatus hernia. A hiatus hernia is basically protrusion of the stomach into the chest cavity through hole in the diaphragm. So basically there is already an existing hole in the diaphragm through which the food pipe comes from the chest into the abdominal cavity. Now when this becomes enlarged, the stomach protrudes through this hole into the chest cavity, which leads to a variety of symptoms. तो ये symptoms कई तरह के हो सकते हैं, जिसमें कि commonly acidity, burping.
कौन है ये लोग? कहाँ से आते हैं?
पेट फूलना, गैस जैसा लगना या फिर एसिड रिफ्लक्स होना। एसिड रिफ्लक्स कई तरह का हो सकता है। कभी कभी पेशेंट्स को खाली हार्ट बर्न के सिम्टम्स आते हैं कि खाली चेस्ट में जलन हो रही है, लेकिन कई बार इतना सिवियर एसिड रिफ्लक्स भी हो सकता है कि सिर्फ झुकने पे या रात को लेटने पे गले तक या मुंह में या नाक में से भी एसिड का रिफ्लक्स हो सकता है। कभी कभी ऐसा भी होता है कि एसिड रिफ्लक्स कैन बी backwards into the throat, and that can actually lead to asthma-like symptoms. So some patients can actually come with sore throat or even something like breathlessness. So these are all symptoms of severe acid reflux, and that can be because of hiatus hernia. Now hiatus hernia can be of different types. There could be a sliding hiatus hernia, there could be a paraesophageal hernia, there could be a mixed variety. So there are different types. How do we treat a hiatus hernia? Now there are basically different kind of treatments. Obviously when we start the treatment of a hiatus hernia, it is started medically. We always will start with diet and lifestyle modification, which means that we will be starting with a healthy diet, not having very long gaps in meals, eating your dinner early, sleeping with head elevated, and not eating very late in the night, avoiding oily and spicy food. So things like that. The second step would be to put a person on medications, which are usually antacid medications and prokinetic medications, which will basically move the food downward. But if a person is not able to get relief even after being on medications, or if a person is not able to leave the medication, so there are situations when a person is on medications and the moment they stop medications, the symptoms recur. Or if they are on long-term medications, they're taking medications for years, 1 year, 2 years, 3 years, and yet they're not able to leave the medications and they're not able to get a cure for their problem, then in these cases we need to evaluate further by doing an endoscopy, by doing a pH manometry, and then basis those results we can take a decision about whether a surgery for hiatus hernia is required or not. If a surgery is required, this is usually a surgery called as fundoplication, which is done by laparoscopy, and this is basically what we do is that we would go and we would tighten the valve using sutures. And sometimes in rare cases we may also need to use a mesh, and we would create a wrap of the stomach depending on what type of surgery it is. So this would normally help the patient to get relief from their reflux and help them to lead a more healthy life and prevent complications like Barrett's esophagus in future. So thank you very much.